Hi, my name is Geraldine Wilson. Today I'm going to perform a cardiorespiratory assessment for my class 4371 with Dr. Madsen. First, I'm going to come in, wear my gloves, check my patient's ID. Can you tell me your name, please?
David Wilson.
And date of birth?
September 3rd, 1994.
Okay, and I'm going to provide the privacy for my patient. Bedside are low, all siders are up, and the call-out is within reach. Now I'm going to interview her cardio-wise. Have you have any heart problems?
No, ma'am.
Have you have any chest pain?
No.
Have you have any difficulty of moving around?
No.
Okay, or any activities? Any shortness of breath, getting up or doing activities? Any history of hypertension?
No.
Any history of high cholesterol?
No, ma'am.
Have you noticed any swelling in your extremities?
No.
All right. How about family? Has your family has history of obesity?
No.
Any high cholesterol
No.
problem? Any hypertension?
No.
All right. And how about respiratory? Any history of any respiratory problems?
No.
Have you have any shortness of breath?
No.
How about any difficulty of breathing?
No.
Any cough?
No.
All right. And what about your family history? Does anybody who's diagnosed with other illnesses?
My father has childhood asthma, but he outgrew it.
Okay. And anybody has lung problems?
No.
All right. And what about anybody who is diagnosed with lung cancer?
No.
All right. Moving on, I am going to inspect for jugular veins. Go to your side. And no jugular dissensions, 1 cm above the sternal angle. Looking for the hands, the bilateral hands, no visible abnormality findings, no pallor, no cyanosis, no clogging. Capillary refills is less than 3 seconds. Lower extremities, there is no edema, there is no discoloration, no ulcerations, no varicose veins noted, no edema, and no capillary refill is less than 3 seconds. Now I'm going to palpate for pulses, temporal, no, it's pounding, +2, and then also the carotid area. I'm going to examine in each side at one at a time, and it's slightly, it's +2, pulses are palpable, strong and equal. And then here, and the PMI, it's mid-clavicular line, 5th intercostal, and I'm going to do the brachial pulses, strong, equal, +2, strong, equal, radial, strong, equal, +2, femoral, strong, equal, +2, popliteal, strong, equal, +2, posterior tibial, strong, equal, +2, dorsalis pedis, strong, equal, +2. Moving on, now I'm going to perform my cardiovascular assessment. First, I am going to sanitize my stethoscope with 70% alcohol. I'm also going to use my diaphragm to listen to the heart and the bell of the stethoscope. First, I'm going to look at for and feel for the carotid, and there is no trill, it's pounding. The same with the other one. I am not massaging it, I'm palpating it slowly and softly, not massage. Next, so there are trills, pulses are palpable on the carotid area, and also I'm going to listen to the heart now. Start with the aortic valve. S1, S2 is being heard, no murmur, no gallops. Pulmonic valve, S1, S2 is being heard. S1, S2 is being heard. Tricuspid, S1, S2 is being heard. and the mitral valve S1, S2 is being heard. There is no murmur, there is no gallop, there is no abnormalities noted. Their applicable pulse is 70 beats per minute. So moving on, I am going to perform my respiratory assessment. So first, I am looking for the movement of the chest. I am counting my respiratory rate without my patients knowing. Respiratory is 15, even and labored. I am going to touch his trachea, inspecting for trachea. It's no abnormalities. It's intact. I'm going to inspect for the chest, covering the other sides of the body, giving a privacy. And I'm touching for crepitus. There's no crepitus. I'm touching, looking for rashes, lesions, mass. And I'm going to look at, can you sit down for me a little bit so I can see your back? So also looking at the back for the spinal, so for his, so any skin rashes, any lesion, any mass, any abrasions. So I don't see anything noted, nothing noted like that. And I'm going to go ahead and also percuss my patient chest. No dullness, and I'm going can you move your hand for me? Okay, and I'm doing the percussions, and I'm going to anterior is no dullness noted on the interior. I'm going to go ahead and have the patient's back. Can you go with this? And I'm going to percuss and percuss. All the field, posterior lobes, all lobes are no dullness, and I do not notice any abnormalities. Again, I am going to listen for his, I'm going to listen now. So again, the chest is symmetrical. There is no, the breathing is spontaneous. There is no retractions. There is no abnormality on breathing. I'm gonna go ahead, and after I clean my stethoscope, I'm going to use it, and I'm going to listen for the breath sounds. Breath sounds are clear. Can you put your hands on? Okay, I want you to come in this side for me. I'm going to, so again, the breath sounds is clear. I didn't see any adventitious sounds. There is no wheezing, there is no crackles, there is no rhonchi, and it's even. I'm gonna go ahead and, can you move this side for me, please? I'm gonna go ahead and listen to his lungs, posterior lungs. I want you to count 1, 2, 3.
1, 2, 3.
And say E.
E.
Okay. Can you whisper 1, 2, 3 for me?
1, 2, 3.
And E.
E.
All right. Again.
1, 2, 3. E.
Okay. Take a deep breath.
1, 2, 3. E.
Another
1, 2, 3. E. 1, 2, 3. E. 1, 2, 3. E.
Okay. Again, posterior lungs fields are all clear. There is no wheezing, there is no crackles, there is no rhonchi, and there is no abnormalities. Thank you very much, and that covers our cardio and respiratory health assessment.